This video is going to be a tutorial of how to deal with IT band syndrome. As an endurance athlete, typically a runner or cyclist, this can be a very frustrating injury. Personally, I was sidelined for 5 months after I strained my IT band, and I actually did it after a long, hard ride, and I was mowing the grass after I had tightened up, and I suddenly strained the IT band. But typically an IT band issue is one that is an overuse issue, and it kind of flares up during a run or a ride. Now, as a disclaimer in this video, I'm not a doctor or a physical therapist, but I have been racing bikes for over 15 years, and I've found stretches that really work for me. I'm going to show you quite a few stretches in this video. Some of them may work for you, some may not. You may want to try all of them and then narrow it down to the ones that you find more effective, or you may even do all of these. Here are some of the things that you may want to pick up if you're going to do these. One is a standard foam roller. I also like these foam rollers that have a resin core, and this is actually the one that I use most often. This hard center actually gives the foam roller a firmer feel, and I find that it works better. It's also helpful to have one of these stretch balls, and I'll show you why in a few minutes. And then I use a lacrosse style ball, or you can use a tennis ball. As I said, I'm not going to go much into physiology about the IT band because I want to focus on the stretches. But real quick, if you don't know exactly where the IT band is located, it kind of starts up here in your butt and goes along the side of your leg and ends down by the side of your knee. Most of the time when you feel your IT band start to flare up, you're going to have pain on the side of the knee. What I've noticed is when mine starts to flare up, it really starts down next to this bone, which is where it actually ends. The connective tissue is here. And I find that this is where the pain starts, and then it kind of radiates up next to the side of the knee. So let me start with the foam roller, and this is the most common type of stretch that is recommended for IT band. I'm not going to focus too much on this because a lot of the stretches I show you, I want it to be some that are more unconventional, because there are a lot of videos out there on how to do an IT band stretch with a foam roller. But really all you do is start off by putting the foam roller just below your hip bone and just go back and forth. Now when you first start doing this, it's going to be very tender, so you probably want to put your other leg on the floor and kind of unweight your leg until you really get used to putting that pressure on the IT band. Now I've been doing this so long that I can just put all the pressure that's possible on the IT band as I foam roll it. And just go back and forth, and when you feel a spot where you can really feel it stretching down by your knee, just stop and hold it for about 20 seconds. That can be painful, so again, you may want to put your other foot on the ground and unweight your IT band on the foam roller a little bit. So go back and forth, and then also go above the hip bone. So you want to kind of get right here above the hip bone, just back and forth a few times on that. And then also put the foam roller below the knee and just go on the side of your leg, because I found that even though the IT band doesn't go past your knee, all of those muscles and tendons and ligaments are connected, and stretching the side of my leg below the knee also helps with the foam roller. Now the stretch with the ball. And I use a lacrosse ball, but you probably want to start with a tennis ball when you start this, because this can be somewhat painful. So what you're going to do is you're going to take the ball and you're going to put it on the IT band just below the hip bone. And it takes a while to find the spot, but when you find it, you're going to really feel it pull next to the side of your knee. And if your IT band is really tight, that pain on the side of your knee is going to be pretty prominent. So this is one you might want to ease into, but this is one that I found was extremely effective when I was sidelined with my IT band syndrome. So again, just put it just below the hip bone, and once you find that spot where you feel it pull on the side of your knee, just hold it for about 30 seconds. For this stretch ball, I use this to stretch the psoas muscle. And the psoas muscle kind of goes around the pelvis and wraps around. And the hip flexor, psoas, IT band really are all connected. This is not a typical IT band stretch that I've seen, but it is one that I found to be effective. And what I do is I put the ball kind of just inside your pelvis and you lay on it for about 20 to 30 seconds. And again, you're going to feel that kind of right inside the pelvis, just stretching the psoas muscle, and really just hold that. And by the way, let me mention that these exercises that I'm showing you, you obviously want to do on both sides. I'm just showing you one side, but you want to repeat this for both legs, for both IT bands. For this next stretch, I'm going to stretch my left IT band, and I'm going to put my left heel on the floor and just kind of angle my knee a little bit. Now I'm going to take my right leg, put it over the left leg, and then rock it down, and try not to let your hips rotate a lot. Just kind of try to keep your hips level and just push down a little bit with your right leg, pushing that left leg. And then I usually repeat that on the other side, and then I put more of a bend in my leg. So again, I'm stretching my left IT band, and I'm going to put the angle of my leg a little bit steeper, and just repeat that. Put the right leg over and then just hold it. And you're really going to feel that pull around the hip area. The IT band is very, very stiff. And most of the stretching that you're going to feel is going to be up here in the hip area. And this is one that you can really feel it stretch up here around your hip flexor. And just hold that for about 30 seconds. This stretch is one of the most effective stretches that I've found. It's also one that you need to be cautious with if your IT band is currently flaring up, because it can be painful. And this is pretty unconventional, and you're not going to find this in a lot of other IT band type tutorials, but again, it's very effective. What you're going to do, and I'm going to stretch my left IT band again. I'm going to step forward with my right leg, and I'm going to go bend my knee down to the floor. But as I do this, I'm going to push my left knee inward and try to stick my left hip outward. So you're really going to feel the IT band stretch over your hip. What's also very effective is if you put your left arm above your head and really lean over as you do the stretch. So it kind of looks like this. So again, step forward with the right leg, if I'm doing the left IT band, point the knee inward and push the hip outward and really lean over and go almost down until your knee hits the floor, and then go back up. And I repeat this 12 times. So it looks like this. And then I'll repeat it on the other side as well. This next stretch is similar to the one that I just showed you, in that you're stretching the IT band over your hip. What you're going to do, and I'm going to stretch again my left IT band, I'm going to take my right leg, just cross it over the front of my left leg, and I'm just going to lean, usually holding up against a wall or a chair, and push your hip out, and you're going to feel the IT band pull across your hip. It can also be effective to put your arm over your head as you lean to really pull on the side. Again, you should feel the IT band pull over your hip and hold that for about 30 seconds. This stretch doesn't necessarily stretch the IT band itself, but it stretches these ligaments below your knee on the side of your leg. And like I said before, a lot of times when my IT band flares up, this is where I feel it, below the knee first. So what I'm going to do, and again, I'm going to stretch the left one. I'm going to lay the left leg over in front of the right leg and just kind of lay the outside of your foot down on the ground. And you're just going to go down almost like a hamstring stretch, but you're focusing on the outside of the leg. So you're going to lean over a little bit. You can even put your hand on the floor as you get it loosened up more. And this is one that I hold between 30 and 40 seconds. So you should really feel it stretch below your knee, on the outside of your leg, below your knee. This last stretch that I'll show you really stretches up by your hip flexor. And you're just going to lay your leg over on top of the other one, just like you're crossing your legs. And you're going to just hold it in place. And you're going to lean forward. As you lean forward, you can take your hand or your elbow and push down on your knee to flatten your leg. So lean forward, and you're going to hold this for about 30 seconds. And again, you're really going to feel this stretch by your hip flexor. It also helps to kind of push your chest to the ground. That's what you can think about when you're doing this. So push your chest to the ground, and again, hold it for about 30 seconds. The only strengthening exercise that I'm going to show you in this video is one where you're going to strengthen your hip flexor by simply laying on your side. And this one I'm doing the right leg. And all I'm going to do is lay the leg on the ground and then just lift it up. And I repeat that 25 times. And you may get too sore and only be able to do it 10 to 15 times when you start this. But try to work up to doing 25 times and repeat that 3 times. So you're going to do 3 sets of 25 simply by raising your leg, and you're really going to feel this in the hip flexor. And do this for both legs. Let me wrap up this video by giving you some pointers with IT band syndrome. First of all, if you feel your IT band start to flare up during a run or a bicycle ride, the best thing that you can do is stop. If you try to push through it, you're only going to make it worse, and you're going to make your recovery time longer. An IT band flare-up is one that you're going to have to rest. You've got to let it calm down before you start exercising again. I find that if it starts to flare up and I can stop immediately, if I take 2 days off and get back on it, I'm usually fine. Also, IT band, like I said earlier in the video, is an overuse injury. Typically, it happens when someone ramps up their training too fast. So, if you're riding, for example, you're going to want to ramp up your training slowly. So you may, if you're riding an hour and a half, and you want to move up to 2 hours, do that for a few weeks, 2.5, 3, and so on. So again, if you feel it start to flare up, try to stop what you're doing, even call someone to come pick you up. That's a hassle, but it's more of a hassle if you're sidelined for a long period of time. If you do have a flare-up, anti-inflammatory drugs can help. I really don't like taking drugs, and so I use an ice cup. What you can do is just take a styrofoam cup, put some water in it, freeze it, and then just massage your IT band, especially down around your knee. And you only need to do that for about 2 minutes. So if you've really had a flare-up, you can repeat that several times, up to 5, 6, 8 times a day, and that will reduce the swelling in your IT band, which increases the blood flow and will usually help it heal faster. This next tip that I'll give you is honestly one that I've never heard anybody else say, but I found it works for me. And it's so simple that it may be profound to you. And that is simply crossing your legs when you're in meetings. If you've only had one side typically flare up on your IT band, I'm going to bet that it's the leg that you don't typically cross when you're sitting around or sitting in a meeting. I usually have my left IT band flare up. In the past, I've always crossed my right leg when I'm sitting around, either this kind of cross or like this. So if you typically only cross one leg when you're in a meeting, do the other one, and do this kind of cross and one like this. And when you're sitting around, or again sitting in a meeting, do this and just kind of lean forward against a table or a desk. If you can repeat this throughout the day, it can really loosen up your IT band and may really help. Again, that's very simple, but it may have profound results for you. So that's going to wrap up my video tutorial of how to deal with IT band syndrome. Like I said in the beginning of the video, this can be a very frustrating injury. So I encourage you to be patient. Some people may recover in just a few weeks. Some people, it may take several months. But do these stretches. Don't just sit passively and rest. Be diligent about doing these stretches. Try all of them. Find the ones that work for you. And let me know in the comment section which ones you found to be most effective. Thanks for watching.